Well, good day and welcome to IndePractice Presents on this Thursday, the 19th day of October, 2023. My name is Mark Maloney. I'm the CEO and founder of VenOps, a specialty compliance company that focuses on medical practices. Our sponsors today for the webinar include VenOps, the Medical Association of Georgia, and Medicare on Demand. Today's webinar is about Medicare plans and how they affect your patients and your practice. Our special guest is Kevin Carey, who represents Medicare on Demand, a company that facilitates Medicare programs for over 650 hospitals and healthcare networks in the United States. Our purpose in bringing you this information is to help you understand how different Medicare plans benefit both your patients and your practice, and sometimes can affect their network in which they get care. So, Kevin, welcome to the webinar. Do you mind Thanks. Do you mind if I ask you some questions or interview you about how Medicare on Demand can help our viewers?
No, just so the viewers know, I'm sitting here in Savannah a day ahead of the Medical Association of Georgia's annual HOD meeting. And I must say, there's quite a heritage here in Savannah. It reminds me that leaders understand, appreciate, and build on heritage. We're going to talk a little bit about that in the comments I'll share today.
Well, thanks, Kevin. I appreciate that. Maybe we should start with a little bit of background and sort of describe the Medicare marketplace today and kind of help us maybe understand why we're doing this webinar.
Awesome, sure. Be happy to do that, Mark. Before I do, though, I'd like to just share with the group that I flew in here to Savannah yesterday from Orlando. I was attending the NCPA meeting, and a leader from Georgia, Hugh Chansey, who's with Chansey Community Pharmacies in South Central Georgia, had brought all of his independent pharmacies together for the NCPA meeting. And they have quite a grassroots initiative underway called Community Pharmacies and Enhanced Service Network. And that was really spurred on by the fact that community pharmacies have lost about $2 billion in revenue over the last 2 years. And they've lost that revenue to, by and large, payers and PBMs collaborating. And they got this program, direct and indirect remuneration. And what that's translated to for a lot of these pharmacies is an unintended consequence. A lot of community pharmacies are going out of business today. So I just thought I'd share that just as a backdrop for the group here. Sure, the Medicare marketplace, there's a lot going on. The Medicare enrolled population is going to basically double in size between now and the next 10 plus years. A lot of the physicians that are serving senior patients they're losing control of their time. They're spending a lot of time having staff spend time with a lot of administrivia. There's a lot of confusion being sowed into the marketplace. There's Hollywood actors that are getting involved, big box stores that are getting aligned with payers. And here in Georgia, there's quite a legal battlefield underway as well. A lot of tort reform needed. That's putting a lot of demands on independent and all physicians in Georgia today.
Well, that's quite a background. Let's talk a little bit about maybe some of the things that physicians, both in independent practice and in hospital practice or network practice, can do to benefit their patients and to benefit their practices, especially those that are members of the Medical Association.
Sure. A lot of it comes down to better alignment, patients' needs, and being able to see the doctors that they see, just through better alignment. And there are a couple of really good examples out there. This program, Medicare on Demand, has already been rolled out by Emory and Northeast Georgia. And so MAG physicians might follow Emory's and Northeast Georgia's lead there, and for two primary reasons. One, to drive better clinical outcomes through better continuity of care, aligning patients' needs with the doctors they see. And two, to relieve some of the downstream pressure on revenue cycle. You know, how the physician practices actually get paid. And some of that pressure could alleviate some of the time and resources that are being spent today on pre-auths and appeals and denials, just by better aligning providers with payers that they want to stay partnered with, and really terminating plans that they would like no longer to be contracted with.
So if I were an independent medical practice, 4 doctors, 10 doctors, and I really wanted to learn more and see how this might be implemented into our practice, can you kind of describe the practical sort of steps of what an implementation might be like? You know, what you would do for the patients, you know, what information could you give them in the waiting room or guide them online, and how this specifically helps the practice?
Yeah, well, the good news here again is that there are 650 health systems across the country that have already deployed this platform. So it's turnkey, it's no cost, it's a resource.
Let me interrupt you. Did you say no cost?
No cost.
I don't mean to throw you
Yeah.
softballs, but that I heard that one loud and clear.
Yeah. So it's already been deployed across 650 health systems. It just hasn't, the power of this platform hasn't been put into the hands of physicians quite yet. Historically, it's been a health system that's been the sponsor, and then, you know, it's kind of been left up to the health system to engage the physicians. And we're finding that we actually need to go a step further and put the power of this program in the hands of physicians. And what happened then is basically a practice who's hearing this message and is interested. For those that are attending HOD here in Savannah this week, please come to our booth. Please come to the Shark Tank. The chairman of Medicare On Demand will be presenting at Shark Tank. For those that aren't able to make it, there's Mark's email, phone number, schedule a call, schedule a visit. We'd be happy to provide an overview presentation. We have a couple of short 2-3 minute videos that you and your staff can watch to get oriented to the program. And then it's a matter of getting you plugged into the platform, both online as well as maybe putting rack cards that we would create and provide to your office, so that when seniors come in and ask for guidance on Medicare, you can point them to the website and you can point them to the rack cards.
Thanks a lot. I'm not sure if you could hear that airplane or not. My studio is right off of Dobbins Air Force Base, and occasionally I get some C-130 interference, which I welcome. The sound of freedom. So has this
Absolutely.
Has this platform aimed at medical practice been deployed elsewhere, or are we sort of a pilot program?
We're getting more and more interest among physicians. Of course, physicians are now aware that this is out there, that the need for better payer-provider alignment is there. You know, these seniors look to physicians and have trusted them with their healthcare. Now seniors are wanting to look to their physicians to help them make a more informed decision on Medicare coverage. So large groups like APG, there were a couple that attended our webinar last month. Within an hour, they called and wanted to deploy the platform. We're starting to talk with large independent physicians associations and ACOs in the states of Texas and Florida, and of course here in Georgia, and getting a strong response.
So I like what you said about bringing a program into the practice, rack cards in the waiting room, different ways of getting information, because I suspect, and I don't know, that many patients as they approach Medicare age or are already in Medicare age try to get a lot of this information from the practice, from their doctor, and that must take a certain amount of time. And by having a program like this in place, that the physician or the practice or the staff can refer the patient, would let them get back to taking care of patients and not so much educating them on Medicare and Medicare plans.
Yeah, it's really putting a robust resource, single source of truth on Medicare in place as a resource for your patients that's unbiased by insurance companies and brokers. What's happening today is, an insurance or broker, they'll get certified on one plan. Plan benefits change every year, so they stay up to date on one or very limited number. The Medicare On Demand platform gets deployed in your county. It knows all the options that are available to your seniors, gets vetted through you. Like I said, those plans you want to stay contracted with, and then you have a seamless transition capability to terminate plans you don't want to stay contracted with, and have you retain your Medicare patients and associated revenue versus having a terminated plan redirect those patients to another provider, not you, that remains contracted to that plan.
So, do you have any specific suggestions for the physicians if they want to try to learn more, or is there a place that they can go to learn more, or should they just simply reach out to us, at IndePractice? What do you suggest there?
Definitely, if this is of interest, I would communicate that to the CEO of MAG, the president. I would put a call into you, Mark, email expressing interest, and we'd be happy to follow up with an overview and get your practices plugged in.
So my cell phone is 678-895-1159. An easy email is info@venops.com, and Venops is like V like Victor, E like Echo, N November, OPS like Sam.com. Or even maybe easier is go to the MAG website and click on IndePractice, or go to IndePractice.org and sign up. When you sign up, we'll reach out to you and give you as much information as you like. Kevin, I want to thank you very much for coming to us today. This concludes this portion of the webinar, and we will bid you adieu and have a great time in Savannah. And don't forget, there's a bench down there that Forrest Gump sat on in the movie, and that's a great view, and you can catch the bus there.
Awesome. Excited to be here.
Oh, thanks very much. Take care.
Thank you.